sometimes it's not just by talking about the darkness that you've experienced in the world, but also creatively finding ways to bring light into your world. And sometimes that's through art. Sometimes that's through music. Sometimes that's through food. Sometimes that's through a number of different things. And so we work together with you to explore how to get from a dark place to a brighter one.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top practitioners in health and beauty, both inside and out. I have Dr. Christian Gillespie, a licensed clinical psychologist, nationally recognized speaker, entrepreneur, and founder and CEO of Hope and Harmony Wellness Group, where she is pioneering a bold approach to wellness that integrates mental health, aesthetic care, and holistic healing of the mind, body, and soul. With executive leadership experience overseeing mental health operations across more than 30 correctional facilities, she has influenced systems of care on both individual and organizational levels through clinical expertise, consultation, expert testimony, and transformative trainings in trauma-informed and culturally responsive practice. As the founder of the Love is Great Foundation, an ordained elder, youth pastor, and an unwavering advocate for equitable access to healing, Dr. Gillespie is committed to empowering individuals and communities to heal, thrive, and live with purpose, embodying her belief that where there's hope, there's healing. So, Dr. G, welcome and glad to have you here.
Thank you so much for having me, Daniel. I appreciate it.
Yes, let's start from the very beginning. What got you first interested in, let's call it the broad medical field?
Oh, that's a really good question. To be honest, I started off more interested in law. And as I was pursuing or interested in law, I realized that a lot of the individuals in my neighborhood, I'm from Long Beach, California originally, born in Compton, raised in Long Beach. And I realized that a lot of the people in my community were justice involved, and disproportionately so. Seeing that made me want to be able to have some impact on changing that and be the difference. However, I transitioned from looking at it from a law-based perspective to a psychological perspective. Like, how can I work on the mindset that I see among some of the community members that I know and family members that I've seen? Because I realized that you can have a family of individuals and they all take a different approach, even though they're raised in the same home. And so one of the things I realized is impactful there is your mindset. So that's how I got into the mental health field specifically and decided I wanted to pursue psychology.
Got it. Okay. And so now you have your business, Hope and Harmony Wellness. Tell me, what prompted you decide to start your own business?
Well, I had this vision that we should not just look at everything in a silo. I know that we go to our medical doctors and we get our medical services. We go to our mental health professionals and we get our mental health care. We go to the church and we can get our spiritual care. But I wanted to see a space that could be a one-stop shop for services to the mind, body, and soul. Because in my research, what I've identified is that it's all interconnected. Right. And so the way we think impacts the way we feel, the way we show up in our bodies impacts the way we feel as well. And the way we look impacts the way we feel, and all the way we feel impacts our behavior. And our spiritual life is all connected to that as well. How we're feeling spiritually can impact the way we show up in the world, the decisions that we make, and the mindset that we have. So this has really afforded me an opportunity to say, you can come to one spot that realizes there's a relationship between all of those things. You don't have to compartmentalize. You can get all your resources here.
Got it. Okay. And in your introduction, there's this, I guess, concept, which I haven't heard before, of community healing strategist, which is what you are. Is that kind of tied to what you talked about as far as having everything in one place? Is that what a community healing strategist does? Or can you explain a little bit more about that?
Well, I like to consider myself a community healing strategist, although my formal title is a licensed clinical psychologist. But I believe that your relationships with others significantly impacts your health and your healing. And so as a community healing strategist, I look for partnerships with other businesses and other organizations in the community, and I see how we can work in tandem in order to best serve the individuals in our neighborhood, right? And so if that means partnering with various churches and seeing how we can increase awareness and reduce stigma about mental health, then that's something that we do. Partnering with other businesses, like I have Emerged Beauty, which is an aesthetic care practice, but I have them housed in a suite within Hope and Harmony Wellness Group. And that's a strategy to be able to say you can get your mental health services and your aesthetic care services here as well. And partnering with various schools are also some of the things that we look at by saying, what are all of the different resources that are provided in the community? How can we work together in order to best serve our neighbors?
Got it. Okay. Now I want to talk about the individual, because I'm sure that you have a lot of clients, a lot of patients that come to you, and I'm sure there's a lot of barriers that are put up that's preventing them from seeking help, whether it is from a friend standpoint or from a family standpoint or from a cultural standpoint or whatever it is. But could you kind of talk about what are some of those barriers that people typically face when they're looking for some type of help?
Absolutely. One of the things I'd like to point out is there are a number of different barriers that different groups face, but particularly for communities of color, access is a huge issue. And so you don't have very many practices that are either within the neighborhood or walking distance of the community members that need the services, or they don't accept the insurances or Medicaid services, or there's just a limitation on how many people they can take. And so there are long wait lists that serve as barriers for people to get access to care in that way. And there is also a level of stigma. Historically, mental health and medical practices have been used in ways that have harmed communities of color. And so, as we've transitioned and grown and evolved in the services that we've been able to provide, there's still some healthy suspicion and reservation about those services, particularly because oftentimes the providers don't look like the community members that are needing those services as well. And
Mm,
so, one of the things that we do is we try to increase access to services and access to providers that are from culturally diverse backgrounds. And we try to reach clients from culturally diverse backgrounds as well, by reflecting some of their cultural experiences in the services we provide.
okay. And I want to dive a little bit deeper into that part of it, the cultural part of it, because I'm sure that having that therapist or counselor or whoever you're talking to having the same culture so they can understand, hey, maybe there's some cultural biases or cultural norms of maybe the barriers we kind of talked about that, hey, it's not normal to seek mental health. But where do you really kind of see the impact of that? Like having someone that's coming from the similar culture, is it really being able to connect and having that the therapist or counselor be able to understand you, or is there something more beyond that?
Well, it's twofold. I think on the initial front, it's just having the visibility of seeing yourself reflected in your provider. Um, Now, visibility doesn't always mean that you're going to understand, or relating on um, one cultural element doesn't mean that you're always going to understand each other. But I think that it's imperative to be able to see that you are not an anomaly. It's hard to come into different spaces and feel like you're othered, or come into spaces and feel like your own background culture isn't reflected in the services that you provide. One of the things that I mentioned is the history of how mental health and medical services have been used. And in general, the services have been normed and studied on white, male, middle class, educated populations. And so they have been used as the baseline. And then all of the services have been extrapolated to just assume that, yes, it's going to be relevant and effective with everyone if it's effective with this particular population. And so that has evolved over time. We know that there are nuances and cultural differences that play a role in how clients both experience and express mental health or healing. And so we want to make sure that that's reflected. And so not just having clients or therapists from different backgrounds, but having culturally competent therapists who have been trained to explore the client's background and perspective, to integrate their strengths into the services, some of the coping skills that they already use culturally, you can integrate them into your evidence-based practice and services so that they don't have to feel like they're starting from scratch. There are some things that are already working well. And so we have a team of therapists that are very skilled in doing just that.
Okay. And I want to go into another part, which is the access to mental health care professionals. So I've heard that there's also telehealth, which is basically they don't necessarily have to be in your neighborhood. You can basically call them, or I guess do like a Zoom call or something on those lines. But do you really see a difference between someone coming in and being face to face with their therapist, or do you also see the benefit of telehealth and it could be just as good? Maybe it's just the execution of the expert on how they take care of the patient or the client.
Yeah, that's actually a great question. So, when I started Hope and Harmony Wellness Group back in 2020, it was completely virtual. And so, we have just recently transitioned into a brick and mortar facility. Now, if you look at the research, telehealth and face to face services are both effective. So, you're not going to find a significant distinction to say that now you're going to do better because you did it face to face versus virtual. But I do think it's really important to be able to provide options based off of people's comfort and preferences. So while I get a large number of inquiries from people that say, yes, I love the convenience of virtual and being able to do this on the go or from the comfort of my own home, we also get those that say, no, I really like to sit across from somebody face to face, and that feels more comfortable and intimate for me. And so we value being able to provide both.
Okay. Now I want to dive into some of the misconceptions. I'm sure there's a lot of a lot of misconceptions that you hear, or even that your therapist hear from clients. So, what are some of those most common misconceptions or myths that you hear?
That's a really good one. One of the big ones that I see in the communities that I serve, I work with a lot of Christian clients. And one of the big myths is that if you go to therapy, that means you don't have faith. Or if you go to therapy, that means you're weak, or you don't trust God. And so that is often one of the things that I hear when I go and I do talks at different churches or hold community roundtables, or these concerns about what will it mean if I go to therapy and I'm trusting a therapist. And that actually you can have faith and have a therapist all at the same time. And so that's one of the things that we work with clients to explore, that even scripturally there are scriptures that support seeking wise counsel. And so that's one of the things that we talk to our clients about, that faith also requires some work, and that God often puts us in situations where we work with other people that have some strengths that can help us to explore and expand. No different than going to the medical doctor to get your checkup. It doesn't mean that you don't believe in God because you went to the medical doctor for services. The same is true for mental health services. It's all interrelated. So that's one of the big stigmas that I love to help assuage the concerns about, when I see that come up with some of my clients. And that the strength piece is really important too. That some of the strongest clients really would benefit from therapy. And that doesn't make you weak. It actually helps you to be able to show up in spaces and continue to be strong. That everyone needs a space to reset. Everyone needs a space to process what they've been going through and to gain new tools in order to address the challenges they face. So I like to say, even your therapist has a therapist,
Mm,
right? So
mhm.
we all can benefit from a safe space to explore what's going on in our world and get some support around improving.
Got it. Okay. Now, I'm sure that you've also run into situations where your clients know that they need help, they need support in some fashion. I'm sure that you also get others that maybe they don't believe that they need it, but their spouse, their parent, their kids, their friends says, "Hey, you need to go to therapy." So for particularly for the ones who maybe don't believe it can help them, or maybe aren't so sure that they can benefit from it. How does any of this, I guess I'll call it trauma for lack of another word, how does it manifest in their life? Like, what are some of the kind of telltale signs that if someone comes to you and says, "Oh, I don't really need therapy," and you can ask them, "Well, what about this? What about this?" And you start seeing these things, it's like, actually, you do need therapy. Like, what are some of those things, and how does it manifest in someone's life if they've suffered from trauma, but maybe they don't recognize it?
That's a really good question too. So you are on a roll. And so when it comes to thinking about what are the indicators that I could benefit from therapy, and I reframe that intentionally from need to could benefit, because there are a number of different interventions that people can use that can be effective, right? And therapy is one of many, right? I do think that it's important to look at the day-to-day functioning. Let's look at how you're sleeping. If you're recognizing that you're not getting enough sleep, that your sleep is interrupted, that you're having intrusive or invasive thoughts, that's an indicator that all's not well.
Mm,
If we look at your eating, am I overeating? Am I undereating? Am I don't know, perseverating about what I can and cannot eat? These are just the basic functional things that are indicators of like how we're doing. Like usually when we're not doing well emotionally, whether that's depression, anxiety, or trauma, that shows up in our body. Our body keeps the score. So it impacts us when we're trying to regulate, when we're trying to regulate our eating, regulate our breathing. You'll see it show up in your relationships. Are
mm,
you finding that you're having struggles and conflicts in your relationships that don't feel so good or that you're not too happy about? Maybe you find that you have a really short fuse or are very reactive to things that others don't seem to think are that big of a deal or significant. These are oftentimes the subtle indicators and cues that, hey, I really might need to look further into this. And going to therapy allows me to do it with a professional who is licensed or skilled and has the ability to explore these things without making it about their personal experiences. They're able to help me learn about who I am and provide a safe space to do that. And they usually know the right questions to ask.
okay. And let's say that someone is looking for that professional therapist. They've never gone through this before, but they know they need some type of help. What advice would you give to this person as they're doing their search, if they can find that right therapist who really understands them, who can really guide them, has the knowledge and experience, and can help them basically get through this and come out great on the other end of it?
Absolutely. I like to ask clients, what is important to you in relationship? And what is important to you when you're trying to connect and talk to someone? Because finding a therapist is really finding someone that you feel comfortable speaking to. And it's important that you get to show up in the room. So you don't want to sit across from someone that makes you feel uncomfortable or anxious, worried, or scared. If that means that I feel more comfortable speaking to a woman, you have a number of women therapists out here. I feel more comfortable speaking to a man or someone from my background or someone who is warm and compassionate or someone who um, is more cognitive focused and can just keep it focused on like what I'm thinking instead of all the way what I'm feeling. You get to kind of identify what's important to you and filter and sort based on those things. Psychology Today is a really helpful tool to be able to filter and sort and find a therapist that's right for you. But really, it's just getting into the room and exploring what it feels like. You
Mm,
can go into the room and say, I'm not really sure what to expect here, but I'm giving this a try. Here's the things that make me feel comfortable, if you even know those things, and then see how it goes. Just because you start a therapy session and you meet with a therapist a couple of times doesn't mean that you are wed to stay with that therapist. You both should be exploring whether or not this feels like a good fit. And it may take some time for you to warm up, but you can also ask your therapist questions about their style and their background that help to invite you in to see whether or not this is someone that you feel comfortable speaking to.
Okay. Now, Dr. G, where do you think the future of mental health is going?
Ooh,
Mhm.
can you reframe that question for me a little bit?
Yeah, so I guess as far as is there anything evolving when it comes to treatment techniques? Is there anything from a legal standpoint that's changing that people need to be aware about? Do you think the future is bright? Do you think things are going in a good direction or not going in a good direction?
That is a very loaded question. And so I'll try to be concise. I think, in terms of clinical progression, we are going in a phenomenal direction. I think over time, we become more open to exploring a number of new techniques and interventions, incorporating interventions that are reflective of the diverse clients that we serve, and even reaching out to clients in different and new ways to help them to know that there are services out here that are available to you and that can help you, so that it's not a monolith of who's actually accessing the services. So that part is great. I think that part is incredible. That said, I do see that there are some shifts that are happening as far as access to care is concerned, particularly with funding cuts that happen to programs like Medicaid, which service a population that is at risk, that have higher rates of mental illness, but limited access to resources, and that largely reflect a lot of clients of color and from diverse backgrounds as well. So in that respect, I think that those those things are concerning, and it is really important for people to be aware of the legislation and to explore how they can get involved and vote the right people into office that are going to support and help us to continue to make progression with expanding access to services for everyone.
Okay. And also with the future in mind, what is the vision you have for your practice?
Hmm. The vision that I have for my practice is really just to be a resource for the neighbors that are right next door. Um, I know what it's like to have people who are struggling and to be someone who's struggling and feel like you have no one to talk to. And so, my hope is that people, when they see Hope and Harmony Wellness Group, they recognize that this is a place that values reigniting hope in those that feel like they've lost it. Um, who support you not only feeling good in your mind, but in your body and in your spirit as well, and who are going to partner with you to find creative strategies to help you do that. And sometimes it's not just by talking about the darkness that you've experienced in the world, but also creatively finding ways to bring light into your world. And sometimes that's through art. Sometimes that's through music. Sometimes that's through food. Sometimes that's through a number of different things. And so we work together with you to explore how to get from a dark place to a brighter one.
Okay. And Dr. G, I do have one last question for you, but before I ask it, I do want to point people to your website at hopeandharmonywellness.com. Now, last question for you. What does beauty mean to you?
Mhm. Beauty is in the eye of the beholder. And so I think it's important for people to behold themselves fully, to really look in the mirror and take inventory of everything you see, the parts that appeal to others, the parts that appeal to you, and the parts that don't, and hold it in all of its truth. I think it's beautiful when you can sit honestly with yourself, honestly in the presence of others, and work to grow the parts that don't feel so good while celebrating the parts that feel great. Beauty is really health, health for your mind, your body, and your soul. That's what's beautiful.
Okay. Well, there you have it. Dr. G sharing her expertise. So, Dr. G, where can people contact you and your practice?
Well, if people want to contact us via email, they can contact us at let's talk at findhopeandharmony.org. If they want to contact us by phone, they can contact us at 618-201-7591. Again, that's 618-201-7591. And again, you mentioned our website as well. hopeandharmonywellness.com.
Okay, awesome. Well, this is great, Dr. G. Thank you for coming on and thank you for sharing your message.
Thank you so much. And I neglected to mention that we are also located right in the heart of Carbondale, Illinois, in the Murdale Shopping Center. And so you can always find us there as well.
Awesome. Well, thanks for coming on.
Thank you.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.